Dr. Carl Rothschild, thank you for being here with me.
My pleasure. It's always, I love talking about this subject matter, so I look forward to the opportunity to share what I know.
And the subject matter is RLT, red light therapy.
Exactly.
Okay, so we'll get to that, and there's a lot to talk all around that. I was first going to ask you where you are based.
Well, I'm right now in Los Angeles, California.
Okay, but it's not regular?
Well, no, it's regular. I was just going to say that I'm originally from Brooklyn, New York. And in the 1970s, I decided that I wanted to become a chiropractor. And I moved all the ways out across country to California to go to what at that time was the best chiropractic school in the world.
And you've stayed ever since?
Yeah, it couldn't get me out of here. I mean, would you go back to New York when the weather here is wonderful, and I made a lot of friends and a lot of connections. And at the time in 1970s, when I was started in chiropractic, California was literally a mecca for chiropractic. I mean, I would think 20 to 25% of the world's chiropractic population was based in California. It was a mecca. People
Did it originate in California?
No. Originate? No.
So
it originated in the Midwest. Actually, I don't know where it originated, but I think it would be in the Midwest.
So why was California? Why did it become a mecca?
Well, at that time, Jerry Brown was the governor. Now, this is he became a governor again years later, but his original period of being the governor of California, he was really hippie of sorts. I can't remember the woman that a famous actress and a singer that he hung out, and he was really he helped create a very liberal environment for health and well-being. And but it's not just him. The state itself leads itself to people that are much more interested in well-being and health. I mean, when I was living in New York, remember, I'm 72 years old, so I go back a little bit. And when I was a kid, if you were to go to the gym, it didn't exist, but if you were to go to the gym to exercise, didn't have spas, didn't have things like that. Everyone would think there's something weird about you, like you're spending all your time on yourself. You should be working or taking care of your kids or whatever. But going to the gym for an hour or two is selfish, the way it was looked at back then. And that's quite different than in California, where people started, I think a lot of the gyms may have started here. I can't swear to that, but it became a really great environment for chiropractic in general. And that's why the insurance companies freaked out, because they recognized that we were becoming very powerful, and so they came down on us very hard. So insurance now is pretty miserable in California for chiropractic, to be honest with you. I mean, especially because you get spoiled like me when I started with the Jerry Brown background and all that stuff. Whatever you charged, they pretty much paid. I mean, it was crazy. And the deductible was next to nothing. The co-payment was a couple of dollars. And it was just very easy to build a business, and it's not like that now. But yet and still, there are so many people that want to go to a chiropractor. The chiropractic still continues to grow.
But why? Just certain insurance companies won't cover most chiropractic modalities?
They cover a little bit. They either don't cover or they cover very little bit. So, I mean, it got to the point where there was some insurance companies where the person would have to pay more to get their nails done than the insurance would pay us for an event, a care. Now, a bunch of chiropractors just went to cash only, but it's easy enough for a veteran, but for these younger kids coming out, it was not as easy. Anyhow.
Yeah.
Long story short, I was a bit of a hippie, my own version of a hippie back in the early 70s, and hair down to here. And my notion, and I was a very good student, pre-med and all that stuff, but I had a rebellious part of myself, and chiropractic just seemed to fit that bill. Being somewhat rebellious, and my goal was to help people and less concerned about making money. And I just love the notion of chiropractic. When I talked to chiropractors back then, and it's still true today, that the average chiropractor doesn't look at it as a job. They look at it as, fun, and then as a career and helping people. And I got, particularly over the years, that's 47 years ago when I started, I got tremendous joy out of helping people. And then about 27 years ago, give or take, so I'm 20 years into my practice, thinking I know everything, and a relatively famous orthopedic surgeon out here in California got big in red light therapy. He was the first one really to get it FDA cleared and all that sort of stuff. And I knew him before he was involved with red light therapy. And he said, shine a light on somebody and it's going to make a difference. And I had my doubts, let's put it that way. I mean, just, I knew everything, I thought, at 20 years in. And, but I tried the light. And to be honest, it revolutionized my practice. I was able to heal things I never thought possible in the past. And we were using this device that was state of the art at the time, but what equipment that we have now is many thousands of times more powerful and more effective. Yet and still, I was like, a patient would come into my office and go, I have gum disease. Do you think you can help me? I don't know. What we knew with the lights was that you couldn't hurt somebody. That was it. They didn't even know why it worked particularly. And now we do know, but which I'm going to go over with people, why and how it's so amazing. But this lady said she had gum disease, and we worked on her gums, and it worked. And this guy said he had kidney problems, and it helped him. And it was just constant.
And how were you administering the light? Like, so what does that look like?
The device we had back then was called a laser. And it had, if you've ever seen an ultrasound head or something like that, it had a head maybe that big around. I'm not great at doing this. So maybe 2 or 3 inches across, and you would apply it on the body part that you were working on. So for the mouth, I just I said, open your mouth, and I put it in as best we could.
And for how long?
Well, each treatment back then, I can't remember. I don't know, 10 to 15 minutes, I suppose.
And was
this about 27 years ago?
Yeah, and but the protocol, you were experimenting, or you were learning from the orthopedic surgeon that you mentioned? Like, how are you coming up with a protocol for using it and then seeing results?
Just put it on there, and chiropractic in general is 3 times a week. When I'm working on a new patient, unless it's an emergency, someone that just ripped something, whatever horrible situation, usually most cases are 3 times a week. So I did the same thing with the lights, 3 times a week. I think 15 minutes a shot or something like that. And so you would you'd lay that on and around the shoulder, for example, if I was doing the shoulder, or whatever body part I was going to be concentrating on.
And what were your thoughts after seeing the results? Like, was it the gums situation that was the catalyst for your extra deep interest in the in the area?
No, it's hard to say which was the one that. Well, you have to understand that over the years, the equipment, as chiropractors, because we really took to it. Like, this orthopedic surgeon was trying to get his colleagues to sign on with him, and they wanted to do the surgery. They didn't want to not do the surgery. Now, the laser was to help, either to avoid the surgery and or to help right after the surgery. So he didn't get any orthopedic surgeons, really, hardly any, to join on with him. But the chiropractors took to this like you can't believe. Imagine a natural healing. There's nothing, you're not putting anything in the body. You're not yanking anything out. You're not damaging. You're not injuring. You're using an element of sunlight, just magnifying it to a degree and driving it into the person's body. And I'm going to go over how this sunlight and the miracle of the body, whether you're a religious person or evolution person, it's the same as far as knowing how it works. And we'll talk about that in a little while. But at any rate, getting back to 27 years ago, I'm getting involved with laser therapy. And then over the years, things got stronger and more effective and even better results. But then about 13 years ago, it was discovered, not by my company, but a different company, that there was an element of red light. Now, up until that point, I only use near infrared. And we'll talk about lasers and, we'll talk about near infrared, far infrared, infrared in general, and red light in just a moment. But I was only using near infrared at that time. And there was a separate company that mistakenly were using red light for healing. I'm telling you, near infrared is the miracle wavelength. And red's fine, it's okay, but I have to choose one or the other. But what they discovered by having red light only by accident is that they learned that red light could help with fat loss. And there's all kinds of evidence. It's not like I'm not just talking about this. It's clear that it works. And I'll talk about how that works in just a moment as well. But that triggered me and my partner to decide to start going into manufacturing our own equipment. And that was about 13 years ago, give or take. And we were involved with lasers, and we were involved with panels and pads on the body. And it was nice, it was good. Chiropractors love toys, to be honest with you. You go to the average chiropractic office and they got a ton of toys. They just love them. So they have hyperbaric chambers, and they have cold plunge. Well, they would recommend cold plunge. They would recommend all these different things. And in retrospect, they were good. I had a lot of these toys, hyperbaric, but I also had PEMF. I also had hydrogen and oxygen and all these different things. And they were good. But I'm going to jump ahead and tell you that this bed, and beds in general, but this bed in particular, has taken us to a whole nother miracle range. And we'll talk about that in a second. But there I am doing manufacturing and having very good success with local things and fat loss and things like that. And then COVID hits. And our practitioners wanted less physical contact between the patient and the provider. And we came up with a bed. We said, okay, with the bed, you don't need staff at all. The patient, I have a bed here. I get in and out of bed myself. I don't need anyone to help me. Where all the other modalities need supervision, someone has to do it. Typically, it has to be a female because, men don't mind a woman being in there, but women don't like a guy in there. So, they're in their underwear and sometimes less. They don't want a guy in there doing, working on it. So you'd have to have a female staff member. You're talking about $2,000 a month, I would imagine. And with the bed, you don't need that. You don't need staff. So we started delivering back that many years ago, just expecting that it would be a nice substitute for what we were doing up to that point. And little did we realize that what we have since learned is that when you bathe the whole body at the same time, you experience these unbelievable results. So let me give you an example. And I start off some of my lectures when I'm talking to practitioners. I say, what would you do if someone called you up as a practitioner? So pretend if you're not a practitioner, that you are a practitioner. What would you do if someone called you up and said, I'm having a heart attack once a week, if not twice a week? And that's been going on for 12 years. So 12, 13 years ago, they implanted a defibrillator in this gentleman's chest. So every time he died, it would zap him back to life. And clearly, before they ever implanted the defibrillator, he was in trouble, even back then. Then he had hundreds of heart attacks. What would you do? What would you say to somebody when they called up and said, can you help me? I don't know if anyone out there would say, yes, come on in. I got the answer for you. Because nobody at that point had an answer for him. So the practitioner called me up and said, should I even treat this guy? I don't want him having a heart attack in my office. I said, let's just treat him for 5 minutes. We know that the lights at worst will do nothing. That's the worst that'll happen. And at best, who knows? We're learning more and more what it can do, but we don't always know. When someone calls us up with some rare hereditary disease or weekly heart attacks, at the time, who knew? So the patient comes in, has his 5-minute treatment, goes home that night, and that was not quite 2 years ago, has not had a heart attack since. After hundreds of heart attacks. Now he's had more treatment, no more heart attacks.
Yeah.
And I'm going to send you these videos that you're welcome to share, testimonial videos, because I'm as surprised as anybody. I call the guy up and I go, how's it going? And did you have what happened with you? And he started describing the whole scenario. And after basically a couple of weeks, everything came back to life. He didn't suffer from the erectile dysfunction any longer. His blood pressure is normal. His pulse is normal.
So
every organ and gland was coming back to being normal.
So what is the position of mainstream healthcare in the United States when it comes to red light therapy today?
Where are you located?
I am in Florida.
And Florida has, next to California, is the next most popular place for well-being and health. I mean, it's unbelievable how many people in Florida. But in this country, what do you think the greatest motivating factor is in the world of well-being and health? And it's green.
Marijuana?
No, I'm saying motivating factor. I should have just said it's money. And so what are you going to do when you can make a lot more money doing this than that? Literally, what would you think would happen in this country if this can make you $50,000 and this can make you $1,000? What are you going to do?
Go with the one that makes you 50.
Right. And so alternatively, what are you going to do if this one doesn't make you healthy, but makes a lot of money? And this one can make you healthy, but not make as much money. We're still going in that direction. That's just the way it is. It's money is the biggest motivating factor in this country when it comes to healthcare. And that's sad. I believe in capitalism. I really do. I think it's great to reward somebody for their efforts. In the socialism countries that had socialism like Russia, their biggest problem was that this guy over here is killing himself at work and always on time. And this guy comes in drunk and always late, and you can't fire anybody.
So
one huge union.
When talking about red light therapy and accessibility to everyone, is it something that's realistically accessible to everyone?
I'm not sure of the question. So are you saying that there are a lot of pieces of equipment throughout the country?
No. What I mean is that, I think there's a view out there, like you need to be like someone with extra money to be able to invest in buying even like one of your products for yourself, or even to pay to go to a clinic for that, specific therapy. Or is it something that one can actually, gain access to even in alternative ways with less fancy equipment? How does that work?
I don't want anyone getting less fancy equipment. They need to get the top of the line medical grade. So there are three possibilities, and we're jumping ahead and around, but I don't mind that. Number one, there are people that just want to get treatment. So I don't know if you've ever had an MRI or major X-ray. You don't have to have it in your home. You're going to go to a location near you and have it done there. So we have hundreds of locations throughout the country. I recommend that you try it out. I have one of my staff members make this for me. Do you see what it says?
Get in the bed.
That's my attitude.
Yeah.
Just get in the bed.
But so, so someone has an ailment that they're looking to solve and they want to try out red light therapy. So they find a center around in their, vicinity, local vicinity that they can go to. How many sessions are we committing to? Or, I mean, I don't talk about. I don't mean.
Wait. Let me just tell you how to find the location. You go to trifectalight.com.
Okay.
You go to trifectalight.com. Trifecta is like winning the trifecta at the racetrack. And it's because of the three serious, significant elements of the business, which is skin. The skin's going to look phenomenal. Fine lines and wrinkles, skin head to toe, fat loss, and healing. And we'll talk about that, but that's a trifectalight.com. Go to the website, find a location nearest you, and go there. How many visits? Again, remember, I've been a chiropractor for 47 years, and the question always is, how many visits, and how much does it cost, and all that sort of stuff. So let's talk about how many visits. The answer is, first, 6 visits. And I say that because some people will notice a difference in one visit, but it usually takes, I want to give it 6 visits. And at the end of the 6 visits, you'll have, hopefully with your practitioner, they will do what we call a report of findings. And they go over, this is where you were when we started. And it's 3 times a week. So 2 weeks ago, we started here. This is where you are now. And this is where we want to go. So that's what it's going to take. And so it's 3 times a week for 2 weeks to start and see how it goes. And I don't care what you have, even the most serious, most significant, outrageous. In fact, the messier your health is, typically more dramatic the change will be. And I'm talking about any ailment you can think of. Think of an ailment. Parkinson's, dementia, Alzheimer's, multiple sclerosis, rare hereditary diseases, autoimmune diseases. I don't care. Lyme disease, shingles.
Yeah,
we have seen phenomenal results with all of them.
That's a good answer. So I wanted to take you back. So you were about to mention, like, even about the grade of the quality of the products that are out there. You mentioned there's 3 different options or 3 different types.
No, the 3 options were: 1, you're interested in checking it out as a patient. So you would go to the website and find a location closest to you. 2, you have more wealth than health. So a percentage of people, not a huge percentage, but a percentage of people will buy this medical grade, high-end piece of equipment for their home. Now, I'm 72 years old, and I try to teach people how to age gracefully. I always taught my patients that the ideal thing is that your life is like a candle burning bright from the beginning all the way to the end, and then sputters out and dies. Not spending the last 20 years of your life in a wheelchair, can't wipe yourself, clean yourself, feed yourself, anything like that. And I don't want that. I've had patients come into my office. I'm not in practice right now, but when I was in practice, I have to admit that I would sometimes think to myself, I wouldn't say it out loud. It's like I would say, God, please don't let me wind up like that, because that person didn't take care of themselves. And so if you want to know why people don't take care of themselves, typically it's because they're not scared enough. They don't realize that when they're 70 or 80 years old, they're going to be thinking to themselves, what an idiot they were, that they didn't start taking care of themselves earlier. And it's never too late, but the sooner the better. So people don't take great care of themselves all the time, and because they're not scared. So they drink and they smoke and they take drugs and they do all kinds of stuff. And I'm too scared to do those things. I'm a chicken. I don't want to suffer. I want to do the same thing my father did. My father died at 99 years old, and he really didn't have any ailments. He just died of old age.
Did he take care of himself?
Yeah, he never smoked. He didn't drink. He sort of exercised. He did an old man's exercise, kind of like me now, which is treadmill and stuff like that. And he had a great attitude. He was, he would always see light, make it light, not make it dark, not make it heavy. And so he was always joking around and stuff. Maybe that helped as well. I'm not saying there's any one answer, but I'm going to do everything I can to go that way. I don't want to spend the last years of my life suffering.
Yeah.
At any rate,
so one of the thing I was going to say was, and my question about accessibility to everyone to be able to get, this type of therapy, I was going to ask you if, what is, if you can explain the difference between red light therapy and, light from the sun, for example. Like if I'm standing in the sun and getting, 15 minutes of sun to my whole body, is it a similar type of therapy?
So let me just finish with the 3 kind of people, and I will answer your question.
Okay.
So you've got people who want to just try it out, and I tell you, get 6 visits. And so you go to the website, find a location. The second type are people who are just interested in, they have more wealth and health, and they want to take care of themselves, and they get one for their home. The third kind, which is by far the most common, are people that want to make a business out of this. Because when people have this bed, it becomes a centerpiece. It's a magnet for new people to sign up to come to that office, but it's also a huge magnet, so to speak, of the people that are already in your facility. Before you even ever get the bed, you'll probably have dozens of people signed up to want to try it. And so I just wanted to answer that question. Now you want to compare it. So it is based on sunlight. But if I want to clean my car and you give me a water gun, you say, here, wash your car down. Now, I'm just making this analogy up now, so I don't know if it works, but imagine the difference between taking a huge, strong hose and washing out the car as opposed to a little water gun that's squirting it. The sun is wonderful. It does a great job in general, but the high-grade, medical-grade beds that we're talking about are thousands and thousands of times more powerful than sunlight. Do I love the sunlight? Yes.
But without the component of risk.
No UV light, no blue light. Blue light has been shown to have issues with circadian rhythm. We're talking about red and near infrared.
And so now can we then talk a bit about what it's actually doing to your body?
In a second.
Okay.
And because I want to make sure people understand the terminology, red and infrared, and there really is no such thing as just infrared. So first of all, red is red, right? It burns red, and it's in that color range. If anyone really wants to know, it's between 600 and 700 nanometers. That's the range for red light. Above red light, the next area is called near infrared. That's the miracle wavelength. That's the series of wavelengths, I should say, that have the major changes in the body that I have been working with for 27 years, near infrared. And we're also now, over the last dozen years, I'm integrating both red and near infrared. Let's talk about infrared, which there's no such thing as just infrared, but people use that term all the time. Infrared saunas, infrared tables, infrared whatever. And as a chiropractor, I used infrared, but it's not just infrared. It's called far infrared. Far infrared is a very wonderful way of driving heat deep into the body, deeper than a hot pack would do. So a hot pack, to drive it that deep, you'd burn the skin. So it's wonderful to drive heat deeper into the body. But the next day, you're not going to see any changes. It's just something that I could use right then and there so the person's more relaxed to be able to do manipulation or anything like that. Far infrared, near infrared, night and day. Far infrared, fancy way of heat. It's the near infrared that gives you the miracle wavelength.
So what is the miracle
now
wavelength?
We're going to go over the mechanism now, okay?
But that's helpful. That's helpful. And what are the numbers? Do you want to add, because you gave the range of numbers for red light. Do you want to give the ranges for near and far?
Yeah, near infrared is between 800 and maybe 1200 nanometers.
And the
near
far?
Infrared. That's near infrared.
Yeah.
Far infrared's past that. I don't know. I don't really study far infrared very much.
Okay.
Near infrared, but the main ranges are the mid 800 nanometers and the mid 900 nanometers. And that's what we use in our equipment. Phenomenal results. We have two separate wavelengths of red, which is great to reduce fat, but it also has some healing qualities. And then there's the near infrared, which has these nothing to do with fat loss, but the miracle wavelengths. And as I said, go ahead.
I was just going to, I have to caveat, because it's the second or third time when you said talking about the fat loss, and I'm sure anyone that's listening who's dealing with any fat loss issues ever, is their antenna probably went up. What do you mean when you say it helps with fat loss?
Well, that's what we're going to do right now. I love it. I feel like I'm playing hockey with you and you're moving the puck this way and that way. And I like it. I like it. But so let's talk about how it all works. Okay. We talked about going to the website, getting medical grade equipment, We're talking about, by the way, we didn't talk about my book. If you really want to know about red light therapy, I recommend you go to Amazon and put
And
in the word.
also at the end we can give everyone all the links and everything
Okay,
to
but the
find it.
book,
I have the book. Is this the one you're talking about? The one that you sent me? I don't know if you can see this.
yes, that's it. Illuminated
Illuminated
Healing.
healing. Yeah.
So I highly recommend people read that, especially the first few chapters. That'll give them a really good idea of how and why it works. But now let's talk about how it works. There are two completely separate mechanisms. One is fat loss, and that was discovered by accident a little over a decade ago. And then there is everything else, the healing aspects, the hair restoration, anything to do. As I move my hand down, it can help anything we're talking about, whether it's the eyes, the mouth, anything in the face, whether it's the thyroid or throat in general, whether it's any organ or gland, as I work my way down. And to learn more about it for yourself, and you don't have to take my word for it, I recommend you go to Google Scholar. And by the way, I'm going to send you this information for show notes. I'll send all that stuff to you either later today or tomorrow.
Great.
But bottom line is, we're going to get back to how it works, and now why it works. So, and by the way, they've studied this technology for 50 years, and in the whole time, they've never discovered a side effect. No side effect. Can you imagine finding something that can be very powerful and work so well, and the worst that'll happen is nothing? And then the other question is, who can you do this with? Are there any limitations? Are there contraindications? And the truth of the matter is, you can do, I told you about the guy that had a defibrillator in his chest. No problem. Pacemaker, no problem. Metal implants, just recent hip replacement, knee replacement, none of it. Staples, all that. It is a light. It's not heat. It's not ultrasound or electrical stim or any of that stuff. It doesn't accumulate in metal or anything like that. It's a light or a series of lights. So there's really only one contraindication, and that has to do with legal contraindication, not real contraindication. And it has to do with pregnant women. And the reason I say that is that we know in other countries where they don't have so many attorneys, they're not suing everybody for anything they can think of. But, and we already know that the lights would be helpful for the fetus and the mother, but forget about that. If that baby comes out anything other than perfect, they're going to want to blame somebody for that. And I tell everybody, you know what, let's just not be in that neighborhood for a while. And then once she delivers, have that woman come in, especially if it was a C-section, and she's going to recover from that C-section so much faster, so much less pain, and the scarring will be minimal. So fat loss, healing. Let's talk about fat loss real quick. Fat loss is red light only, pretty much. And it's the red light that they found by accident stimulates the fat loss. So how does it work? What they learned, and this took a while to them to learn. They thought it emulsified the fat or liquefied the fat. They thought all kinds of stuff. And the truth is, what they finally realized is that what happens is the fat cell wall temporarily becomes more porous. It doesn't damage the fat cell. It's not like freezing the fat, boiling the fat, lasering the fat, radio frequency, ultrasonic cavitation. You're not doing anything to burst the fat cell, to destroy the fat cell. There's no injury possible. But the fat contents can leak out into the surrounding tissue. And with a unique protocol, we move that fat away from the fat cell and eventually to the liver for use or elimination. There's no pain. There's no downtime. I mean, you can't go home and pig out and get drunk every night. But if you get on a calorically neutral diet and combine it with red light, and there are also 4 things that get in the way for anyone to lose weight, besides hormones and all that other stuff. It's starchy carbohydrates, simple sugars, sodas, and alcohol. If you can limit those, if not, eliminate those, and go on a calorically neutral diet. And I say that because if you put somebody on a starvation diet where they're suffering, they won't stay on it. Maybe they'll stay on it to lose the weight, but then a year later, they've not only put that weight back on, but sometimes even more.
Yeah.
So the
So
best thing is to find a diet that they can do that will be well integrated into the lifestyle. Go
the
ahead. What were you?
the red light therapy, specifically the red light therapy, that's for fat loss, right? As you're talking about, does it have any other benefits besides the fat loss that
Yeah.
they've discovered?
Yes. So as I said, when we started that many years ago, 27 years ago, my company that I was involved with, that orthopedic surgeon, was near infrared only. And at the same time, there was another company mistakenly thinking that red light was also healing. And it is, but not nearly as effective as near infrared. So red light does other things, but not nearly as effective as the near infrared. But when you integrate the two together, the results have been spectacular. And if somebody's trim and they're not worried about losing fat, what we have found is that the lights only affect excessive amount of fat. So the red lights, not like that, the person's not going to be skin and bones when we're done with them, ever. It's just a way of trimming the excess fat. So just to reiterate, red light and only red light will change the fat cell wall temporarily. A day later, it's back to normal. But temporarily allows it becomes more porous, allows the fat contents to leak out. And then with our protocol, we try to move as much of that eventually to the liver for use or elimination. That's fat loss. That's people are very interested in that. It's huge.
They've always been, I guess.
But when they use inferior products, and there is a lot of crap out there. I mean, you can buy shoes for $3. Then should you? But you can. But they're junk. And you can buy equipment that's junk, and they say it's red light therapy, and the person uses it and they realize it didn't do anything. And
So
it taints the whole industry. So
yeah, which makes sense. But how does one know that they're buying a qualified, product besides going to your website?
right. I'm a little nutty about this. I've worked
Yeah.
my butt off to create the premier product. So number one, if you want to do what I'm suggesting, you want a full body device, head to toe, front and back, left and right, inside and out. That's where you're going to see the miracles. You don't see it with local stuff, pads, things on the panels on the wall and all that crap. Also remember, the further away the lights are from you, you lose power exponentially as you move away from the body. So you want the lights as close to the body as possible. And the reason why with our device you can do that is because it doesn't get hot. That's what we've always been working on. That's where the money is. That's why it's more expensive, and that's why it's a higher end device. It's because it's really strong without getting hot. So why is heat a problem? It's not because it's uncomfortable. That's part of it, but that's not a big deal. The big deal is that heat dilates blood vessels, brings more fluid to the surface, and that would block the penetration of the light. So that's why when I go into when I go into the room and I take the hot pack that my nurse put on there, the back is red. It's because it brings more fluid to the surface, more blood to the surface, and it blocks the penetration of our lights. We don't want that. You want the highest grade lights that don't get hot, that are as close to the body as possible. Now, if I can come back to one other thing that I want to talk, many things, but one other thing important is we talked about how it works for fat loss. So let's talk about my more favoriteest conversation, which is about how it heals. And again, if you go to Google Scholar, which is scholar.google.com, did I mention that already?
You did, yeah.
And did I tell you that if you go to Google Scholar or scholar.google.com and put in the word red light therapy, did I tell you how many entries would come back? 3.5 million, over 3.5 million. Or you can dial it down even more so and put in the word photobiomodulation. Photo meaning light, bio meaning tissues of the body, and modulation it does something. So it's just, they studied this they coined that word decades ago when they were talking about how light could change structure or change the body. So now let's talk about a wonderful subject of how does it work for healing. and for hair loss or hair gain and things like that. So what they discovered is that, and again, whether you believe in God or evolution, miraculously, our bodies respond to sunlight. And there is an enzyme in the mitochondria of your body that is stimulated by sunlight and certain elements of sunlight, particularly near infrared. And that element is called cytochrome C oxidase, which is an enzyme. You don't need to know what it is. I'm just telling you it's there. Or it's CCO, cytochrome C oxidase, cytochrome C oxidase. And it is an enzyme that has been shown to stimulate the mitochondria to do its job better. And what's the job of the mitochondria? When I went to school, we learned that there was one mitochondria in every cell of your body. And the mitochondria was in charge of, it was called the powerhouse of the body. It's the reason why you breathe oxygen and eat food, to create this unbelievably important molecule called ATP. If you have a properly functioning mitochondrial system, you'll be healthy. And the opposite is also kind of true. If you have a dysfunctional mitochondrial system, and now there are books on it, and there are diseases called mitochondrial dysfunction. There's actually a disease called that. And what it is that the mitochondria, as people get older and not taking great care of themselves, the system starts to fail. And the production of ATP drops dramatically. ATP is about energy, but it's also about healing. It's about being well. So imagine if you could stimulate the cytochrome C oxidase, the enzyme, to stimulate ATP production by the mitochondria using certain elements of light. You have to have strong lights that are driven deep into the body that don't get hot. Isn't this fun? I mean,
It's
you learn that a body, somehow they snuck a little thing in the membrane of the mitochondria. Now, how much mitochondria is in a person's body? I told you one mitochondria in every cell. Well, we now know that that's not true. And then the heart, which has the highest demand for energy, has over 5,000 mitochondria in each of the heart cells. And mitochondria is so significant and prominent in your body, or prevalent, is that there are literally, mitochondria makes up 10% of a person's body weight. It's unbelievable. That's how prevalent it is, and that's how important it is. And when you have a proper functioning mitochondria, that's why when people hear what I have to say, they it sounds like snake oil. You're telling me that every tissue in the body can respond, whether it's nervous tissue, bone, organ, gland, whatever? And the answer is yes, because every cell in your body has mitochondria, and your cell is from head to toe. So let's take Jessica.
But is that what it does? It stimulates the mitochondria
to come back to life. Yeah.
So before you give the example on Jessica, so I own a red light therapy. I'm not sure if it's infrared or red light, but one of those masks that covers your face. By doing that on my face, I am not stimulating like most of the areas of my body. I'm just stimulating the mitochondrial system above my neck.
So listen, I have been doing this a long time, and we've done local stuff, pads, face masks, panels, and I never got people contacting me and saying, I have Lyme disease for 40 years, and now I don't. Or I had a stroke, and after 8 visits, I'm better than I was before I ever had the stroke.
Yeah, no. So I understand, but I'm thinking from
you're not going to get that from a face mask.
But I'm
thinking I have no objection with the face mask.
But from a person's perspective that is not looking for a miracle, that doesn't have Lyme disease, but maybe wants to improve their just overall energy or skin care, or
it's full body. So I don't have an objection to the face mask if that's what you want. If you want to do something with your face, I purposely don't sell anything but the highest and most effective pieces of equipment. So we only sell
But
this
am I
very,
seeing a benefit? I'm just asking because I genuinely own one. So am I wasting my time by putting it on my face for 15 minutes, or am I getting a little bit of a benefit? I could get
you're
more
gonna,
if I.
I'm sure your face, your skin will be happy about it.
I see.
But as far as the eyes are concerned, you want to have the highest, most wonderful quality lights. And so we don't have people wearing goggles when they're in our bed. They just keep their eyes closed. And why is that? So when I was talking to you about Jessica, she had 16 very serious conditions, including it got into her eyes. She had Lyme disease. She had shingles. She had 20 years of only diarrhea. She had so many different conditions. It was unbelievable. And now she doesn't. One of the things that she had was uveitis. She had the pressure in one of her eyes, which is supposed to be around 10 or 12, was 180. And so once a month, she had injections in her eye. And I asked her, well, what's that like when they bring a needle into your eye? And it's the most horrific thing she could describe. And she was also putting drops in her eye as well. And the drops cost her copayment was $400. And those injections are billed to the insurance at a rate of $5,000 per injection once a month. And if you have it in two eyes, it's 10 grand.
Yeah.
And now she doesn't need that. She doesn't have uveitis any longer. She doesn't have the shingles, the Lyme disease, or any of those things. She had 3 forms of psoriasis. She had plaque psoriasis, guttate psoriasis, and she had psoriatic arthritis. She had the plaque psoriasis. You would see the rash across her, however you want to describe it, across her face, her forehead, and her ears were always red and bleeding. And within a relatively short period of time, that stopped. She also had, from the psoriatic arthritis, she had dactylitis, which is another word for sausage toes, where the toes would be tremendously swollen and black and blue and painful as heck. And after 2 visits, that stopped. No more of that.
Can whether you so if you do have a bed, even if you own one of those or have access to a facility, can you be doing it too much?
No.
So you're like they know that if you go every day, you shouldn't be. There's no danger in it.
There's no danger. I don't recommend it. I recommend, it's the typical treatment. Like what I use is 3 times a week, 12 minutes a shot. Each dose is 12 minutes, 3 times a week. But if we have somebody like, let's say you have a high-end athlete that wants to perform better, they will get in the bed before their activity and they will perform better, more stamina, jump higher, run faster, all that sort of stuff. And then they get into bed again that evening to recover from that day's activity, whether it's from an injury or overuse. So then they wake up the next morning, they describe it as like fresh as a daisy is the way it's described. So we have an NBA team that has it. We have the Olympic Training Center had it. They don't have it now because they moved to Europe and they haven't reformed until the next series for the next series of Olympics. But they had it and they loved it. I interviewed a professional pole vaulter, and the way she described it was fantastic. She loved it. They absolutely love it for the energy and recovery from their activity. So you've got athletes, you've got men's health. We already talked about erectile dysfunction. With women's health, typically we hear about people talking about less painful periods, less losing of their hair. Like women at a certain age, not all of them, some of them will actually start having their hair thin out. And with the red light, that stops. And frequently it'll reverse, so it'll actually thicken. So there's men's health, there's women's health, there's even psychological issues. I got an email from this lady. She wrote, if this is how people feel every day, I can't believe I've been missing out all this time. She was highly depressed. and very upset about her life. She didn't like her life. And now she's great. She loves it. She can't believe how much better she feels. And I'm just giving you one of many examples. We're making a strong push to assist veterans, for their PTSD and a myriad of other issues that they get coming out of the military.
Very,
Yeah.
very interesting. So, and there's only, sounds like still 20 something years in, there's only potential for growth and
Oh yeah,
more room for acceptance and getting
absolutely.
into more people and people figuring out that it can help them. So that's exciting, I would assume.
Well, absolutely. I'm loving it. Listen, it's not every day that someone starts in an industry that is only on its way up. And I did that twice. When I started in chiropractic, there were two chiropractors in the area when I opened up in 1979. And by the time I retired, there was like 100 chiropractors in that same area. But the same thing is true at red light. There were very few people in the country doing red light therapy, and now it's very common. And chiropractors have taken it to a large degree. But again, I caution people that you want to get the highest grade, medical grade device you can possibly get and do full body. I'm
So
very into the full body process.
does your website list clinics that offer
So if somebody
your
wants to
service?
find a location, they go to that section for location, they put in their location, and one of my staff members will find the closest office to them.
Got it.
When we've listed these before in the past, there are creepy people out there that will harass. They just start marketing and selling and whatever. So we haven't been able to list them. So we'll find a location closest to you for you.
I understand. So I wanted to ask you about, I have been suffering from eczema really my entire life. And I have not tried it, but in the last few years, dermatologists have been recommending phototherapy. I think it's called phototherapy. Does it have like similar, does it overlaps with red light or near
I
infrared
think the
therapy?
phototherapy that they're talking about is going to burn the surface of the skin. I'm not sure.
Okay. But it's,
As a chiropractor, I don't, sometimes, let's say, how am I going to say this delicately? Sometimes you're going to be recommended to something that just will make more money for somebody. So if we do something that's invasive, typically it's going to cost a lot more. So cutting, burning, things like that, they can charge a lot for that. When you're doing something that's non-invasive, insurance companies don't recognize yet the value of this. So they just consider it unattended red light therapy. They don't reimburse tremendously for that. But if you want to know what it costs to be sick, if you're not sick now and you're not taking care of yourself, you're going to wind up sick some way or another in your life. I'm not talking about you personally.
but me and everyone, yeah.
So, taking care of yourself now is a great idea. You have no idea, if you've never been to the hospital or you've never taken these various powerful drugs, how much it costs. So just find out how much does it cost in your area to be hospitalized for 2 or 3 days. And it would cost more than buying one of our beds. Now, our beds average about $1,400 a month to lease. So from a business aspect, it's phenomenal. I can't promise, but we're seeing averaging about 10 times return on investment typically. And I don't even know why somebody wouldn't do much better than that. So, but what you're up against in this world is a lot of crazy crap out there that is junk. And so, that's our main competition is crap that comes from China, to be honest with you.
Have you seen many cases of, I know you mentioned earlier psoriasis, but cases of psoriasis, eczema, also of people seeing miracles and seeing, improvements?
The skin, I wouldn't even go to the point of miracle, because the skin has been for years, since we started with the bed, We've had very good success with anything on the skin. I don't care if it's severe acne, yeah, as we said, any kind of dermatitis, eczema, psoriasis, anything like that. We've had great. The skin is the easiest thing. What's been more amazing is some of the other organs, glands. You know, a lady that was, she had stage 4 renal failure, which meant she was a short time, just a little bit down the road, she was going to be on dialysis. And even so, in stage 4 renal failure, her body, I mean, she was yellow, you know, she was jaundiced, and her liver was suffering and everything was suffering. And her kidney obviously wasn't working. And within a month, the kidney, and ever since, the kidney is back doing what it's supposed to be doing. I say kidney because she had donated one kidney to a friend years ago. So it put her in even more peril, the fact that she only had one kidney and it was suffering and struggling. And now it's not.
Do we know? You know, presumably it wasn't the orthopedic surgeon in LA that discovered red light therapy. But do we know where it did originate in terms of first, you know, noticing of testing and seeing the effects that it could have?
So the countries that are going to invest in these types of things are countries that are, again, I like capitalism, but in the world of medicine, having people wondering whether the guy that's recommending this surgery or whatever is more interested in the money he's going to make than my health, it makes me nervous. So these types of therapies like acupuncture, which is now done well here, but prior to that, you had to go to other countries to see it really emphasized with acupuncture, with red light therapy. So most of our technology has been stolen and gone that direction to China, for example. But this is the one example where it came from China to the United States. China was one of the countries that everyone has medical care, and they're more interested in getting someone well than making a lot of money. Again, I don't mind people making money, but I think someone's health comes first. So yes, it was brought here via China to the United States, but then they expanded upon it dramatically. And he did not invent red light therapy. He did the work to get it FDA cleared here in the United States and introduced it to a lot of chiropractors, me in particular.
Very interesting. All right. So super cool. I will, you know, definitely investigate myself. I will go to your website. I will find one that's near me, and we'll see if it makes a difference. I'll definitely.
Where in Florida are you?
I'm in South Florida, next to Fort Lauderdale.
Oh yeah, we got locations there.
Awesome.
Near you.
Good.
In fact, one of my executives lives in Delray Beach.
Lovely.
Not too far from me.
Yeah, lovely. So very nice. So my last question to you, Dr. Rothschild, is what is, and I warned you about this one, but what is
you
something?
did warn me, and I still don't remember what I came up with.
What is something in your life that you know fundamentally changed your mind on over the years? You know, it could be something recent, or it could be something when you were much younger that you used to think of in a specific way, and maybe even dogmatically. That you've changed your mind on.
So I'm going to come up with something that has nothing to do with health and well-being. Okay.
That's fine. Yeah, that's fine.
When I was early 20s, I had decided the last thing I wanted to do was be a parent. I just felt I didn't get it. I didn't appreciate kids. They were annoying and loud, a lot of work. And what I learned over the years is that their kids suck, but your own kids are, and this is, I think, more true for men than it is women. Well, at least it is for me. When a woman is walking down the street with a baby in the carriage, my wife's going, "Oh, so cute." I don't get that feeling. It's not my kid. It's okay. Yeah. You know, most kids in the first couple of months, they're not particularly gorgeous It's rare to see a beautiful baby in the beginning. So at any rate, I don't know if this fits your question, but I had no interest in having children at that age, and never thought that I would. And then I changed my mind. Let's put it that way. And realizing that your own children it changes everything. Changes everything.
How many kids do you have?
I have 4,
Amazing.
2 of each.
So you completely changed your mind.
Yeah. Well, yeah.
I just had my first, or we just had our first, 6 months ago.
Beautiful.
So it does feel nice, and we'll see. We'll try and work our way up, to
Well, it's right around. You got
multiples.
about 13, 14 years before they become a Martian. Where so what they were normal, and then they become teenagers. Like, what the heck? It's not always that way. I've had
Yeah.
2 of my kids are like that, and 2 of my kids didn't go through the teenage crazies. But as long as you're ready for it,
Have no choice, but
you have no choice.
I'll prepare. Well,
And like I said, but yeah, I envy you, and it's just a wonderful time to have a nice, beautiful baby. It's great.
thank you. Yes, and I feel it. So I like that. That was unexpected, I think, and very nice and honest, because you do hear it's not an unpopular, opinion that you hear from young people in their 20s that they're not interested in having kids in this lifetime. Please tell people again quickly where they can, your website, and what else you're up to, and where they can follow you, and your book, and you guide people wherever you want them to find you.
So number 1, trifectalight.com. And you can find locations there. You can learn a lot of there's a lot of valuable information. My other thing that I love is our YouTube channel. So if you go to YouTube and put in the word Trifecta Light Official, you're going to see phenomenal videos. I love these videos. Some of them are me, but a lot of them are testimonials, and we have sizzle reels there. We have all kinds of very dynamic information there. So we talked about the website, the YouTube channel. The next thing I would recommend is, if you're interested, is go to Amazon and get Illuminated Healing. I don't make a dime off of this. In fact, but I recommend, if you want to know about red light therapy, and if you're interested in either being a healer, you have to incorporate smart red light therapy in your life, in your practice. I mean, if I had this when I started out in practice, it would have made my life so much easier. It goes like this. Judy, you're in room 3. She goes into room 3. She gets in the bed. She's done. She gets out of the bed. She walks to the front desk and says, bye, thank you a lot. I mean, it's very easy. Now, as a chiropractor, I'm not giving up I wasn't going to give up my practice of being a chiropractor, but it helped the practice tremendously. Now, I'm not seeing patients now, but using red light therapy and incorporating it with any natural healer, it'd be great for medical doctors, but they still, especially if they're a surgeon, they still don't get it. They don't see the light, so to speak. So website, book, and a YouTube channel. Those are my top suggestions for you.
Fantastic. So enjoy the California weather, and we'll be in touch, and I will test out, the therapy on myself for a little while, at least a few sessions, and see.
Well, send me an email directly to me, so you don't have to go to the website, and I will find a location closest for you.
Lovely. Dr. Carl Rothschild, thank you so much for spending time with me and explaining the different things. And it's almost, it looks like, that it's too good to be true. That's what it looks like on the surface. But like you said, the body is on its own too good to be true. The sun is too good to be true. So maybe red light or near infrared light is the way to go, and
When I
maybe
use the term red light therapy, I'm talking about the combination, integration of red
of
and
both.
near infrared, both of them.
So RLT, red light therapy, we'll test it out. And thank you very much. And for anyone that, I'll add a little disclaimer. You did mention a couple times to go to Google Scholar and type in, red light therapy and photo
Modulation.
modulation, and you'll see millions, right? Millions of different
Well, if you put in
papers.
red light therapy, you'll see millions of entries. If you put photobiomodulation, I think it's about 500,000 entries.
Okay, but enough to browse and see
Oh, yeah.
some of the
So you would
information
put in, for example,
yourself.
photobiomodulation, and then whatever interests you, whether it's lupus or gum disease, whatever, you would put it in there, and they'll see all double-blind studies, research papers, articles, and all kinds of stuff. And
Fantastic.
as
Yeah.
controversial as chiropractic was when I was in as a chiropractor, red light therapy doesn't have the same craziness that we had with chiropractors, because chiropractors recommended no drugs. And so the whole pharmaceutical industry, hated hated chiropractors, and they're very powerful, and they wrote had articles and books written of why chiropractors are a problem. But we don't get that with red light therapy. It's not controversial really at all.
Good. And it's very trendy and hot right now in the world of health and wellness. Absolutely. So good. Thank you. Thank
All
you.
right.
And hopefully we can do this again sometime. And I appreciate it very much. And thank you for sending the book. I have started reading it, and I'll hopefully finish it soon. And it'll be part of my hopefully healing journey. So
All
thank
right.
you.
Listen, you take care. All right.
Appreciate it. Thank you very much.
Thank you. Bye-bye.